Okay, here we go. So I'm gonna go and check on my patient. I've got some orders to do a CVAD dressing. So we're gonna go and knock in and check on him.
Well, I'm not touching anything yet. It's sterile.
Hello, hi. My name's Haliaka. I'm gonna be your nurse for today. I'm just, before we start, I'm gonna verify your name and date of birth. And so I'm gonna go, can you tell me your name and your date of birth? And so I have my, on the computer here, and up here I have Harold Schumacher, 4/19/1965, which is the right order. So I'm gonna say, okay, Harold. My name's Haleaka. I'm going to go do hand hygiene. I'm going to be here to change your CVAD dressing and get you all comfortable. You know, we're going to check and make sure it's okay. Is that okay? And he says yes, it's all right. So I'm going to go ahead and I did hand hygiene. I'm going to raise up your bed. So before I raised up his bed, I gathered all my supplies. So it's all right here. So here we go. I'm gonna raise you up. Okay. Are you comfortable? Okay, you comfortable. Just gonna go and take a peek. And now that I see that, I'm gonna go ahead, before we even open that up, I'm gonna have you put on a mask, okay? So, I'm gonna have you put on a mask, but since you're relaxed, I'm gonna go and put this on for you. I'm gonna have you turn your head that way, okay? Away from the catheter site. So now that I have it all open, I'm looking at it. I'm gonna palpate. Is there any pain going on? Does that hurt? He said there's no pain, it doesn't hurt.
No.
It doesn't look like there's any oozing or swelling or redness, doesn't look angry at all. So I'm gonna go ahead and we're gonna take the dressing off. And you wanna be careful when I'm taking it off, I wanna make sure it's stabilized at the center. So it doesn't pull on anything it's not supposed to.
Hi, I'm Brian. I'm your nurse for today. I'm taking the doctor's orders showing that we're to do a dressing change for you. Is that okay with you? Yes? Great. Can you tell me your full name, date of birth?
Okay. Here we go. So I got this old dressing, drop it in the trash. I'm going to go and look, and yes, everything looks good. The sutures are present. No swelling, no redness, no bleeding. And so I'm going to get rid of this. I'm going to do hand hygiene. And now I'm going to go and open up my sterile field.
Before we get started,
So here's my sterile pack.
I need you to wear a mask.
Got my gloves.
And turn your head towards your left shoulder.
There we go.
Yes.
The IV's running. I'm going to be turning that off. Pause it for now. And do you have any allergies to medications or anything to take? No? Okay. All right, so do you have any type of this? Redness, this one, no drainage of any kind.
Jeez. Okay. Got my sterile gloves on, so now I'm gonna go ahead and take a swab what I want to do is go ahead and clean off all the dry blood. Okay? So I'm gonna go scrubby, just be gentle. Take off all that old dried blood. That, drop it in the trash. So now I'm gonna go grab my chlorhexidine. So we're gonna be scrubbing for 30 seconds.
Ready?
So we're gonna be scrubbing. Scrub for 30 seconds. You doing okay, Harold? Yes, doing fine. Okay, so once I scrub for 30 seconds, I'm gonna drop it, let it, and give it time to dry. Then now that it's dried, I got my my swab for my skin protectant. So this is gonna go on maybe about 3 inches around my site, all around. Put that on, discard. So now that I have that, now it's time for, I'm ready for my dressing. So I got my dressing over here. This special dressing, it has this part, let's see. It already has a bio patch attached to it. So this part goes right there. That's for after. And then, here we go. Okay. I get rid of that. This goes right over it. Make sure it's really sealed to the skin. And then start from one side, make sure everything's sealed to the skin. There is this one piece I have. This is for me to put my date on.
Skin protectant.
Okay. Okay. Drop that. Now that that is done, now I have I have 3 lumens, so here we go. In my pack, I have a new cap. I have to, starting with the one closest to me, I'm gonna go switch out my cap and clean the edge. Scrub it for about 10 to 15 seconds. Once that is scrubbed, I'm gonna go ahead and grab my new cap.
Good thing I'm not a surgeon.
I'm gonna attach it on and then let that sit. I'm gonna go to the next one. So I got my alcohol swab. Go to the next one, take off the old cap. I'm gonna scrub for 10-15 seconds. Drop that. Attach the new cap. Got my last cap. Take off this cap that's already on there. Scrub for 10-15 seconds. Then I'm going to attach my new cap on.
Okay? Pain or discomfort?
Okay, so now that all 3 is done, now my next step is to grab an alcohol swab. I'm going to be scrubbing the edge, the tip, before I add on my 10cc syringe. So scrub that. So what I'm going to do is I'm going to open up my clamp, positive 3 ml, and I'm going to pull back to see if I have positive for blood, which I do, and then put slowly in over a minute, make sure it's positive push. Clamp, unscrew, drop it in the trash. I'm on to my next one. Same thing, I'm gonna scrub my tip. Scrub, scrub, scrub. Then I'm gonna get a new syringe. Same thing, I'm gonna open it up. 3 mLs, Then I'm gonna pull back, see if I got blood. Yes. Then over a series of a minute, I'm gonna go in positive push, and then clamp, discard. I'm on to my last one. I'm gonna go and scrub, 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 scrub. Then I got my 10 cc. I'm gonna attach it, open up my clamp, put 3 mLs in there, pull back, see, make sure I have some blood coming back. Now I'm gonna positive push over a minute. Clamp my line, disconnect, and drop it in the trash. So now that I've done that, make sure all my trash around here is thrown away. I'm gonna clear up my area. All I have left to do is to sign my little thing to put on there. I'm gonna get rid of this. Hand hygiene. I'm gonna go ahead and put my name on it, my initials, the date of time, and no, the date and the time. Yeah, my initials, 10, 15, 24, and 6:30. Okay. So I am gonna put this on my dressing site, like so. You doing okay? You did very good. Look at that, all done. All done. Drop that. I'm gonna go ahead and get you settled. Your dressing is all changed. There's no problems at all. He tolerated the procedure well. I'm gonna document that. Make sure his call light. Harold, your call light is right here. Are you okay? You need anything else? Nope, he doesn't need anything else. So, yep, I'm just gonna go ahead and document that everything went good. He tolerated everything well. No redness and swelling or drainage coming out. Everything was okay. The end.